So now that we've discussed the bones of the skull and their individual bone markings, we're going to make our way into the remaining bones that make up the axial skeleton. So the hyoid bone is next. The hyoid bone is this U-shaped or horseshoe-shaped bone that can be found in the throat. The hyoid bone is very special in that it's the one free-floating bone in the entire body. This means that the hyoid bone does not articulate with any other bones. But that being said, that does not mean that nothing attaches to the hyoid bone. The hyoid bone, in fact, serves as an attachment location for many different muscles that can be found in the throat. The muscles that we use for swallowing will use this bone for attachment locations. So at this point, we've learned the names of each of the bones of the skull and where each of those bones can be found. The structures that we've seen are how the skull is going to look like in a normal adult. However, the skull will look much different during development. And so that's going to take us into the fetal skull. The fetal skull looks quite a bit different than the adult skull does. However, we will be able to see all of the same bones on the fetal skull, just arranged slightly differently. What's important for us to remember is that the bones of the cranium are flat bones, and therefore they undergo intramembranous ossification. Each of the bones of the skull will ossify and form to cover up the brain. However, the sutures of the skull are not formed until later in life, specifically until about 2 years. So the fetal skull is going to be especially fragile as the sutures of our skull bones have not come together. The bones are not tightly held in place, and we're left with these soft spots in the fetal skull known as fontanelles. It is for this reason that when you're holding an infant, you should be very careful with the infant's head. Let's take a look at the fetal skull and the fontanelles that can be found on it. So essentially what we can see here is all of the same bones that we saw in the adult skull. We'll have the frontal bone, the parietal bones, the occipital bone, the temporal bone, the sphenoid bone, and the zygomatic bone. We have our maxilla, our nasal bone, the lacrimal, and the ethmoid bone, as well as the mandible. So we're going to have all of the same bones on the fetal skull, but what we will not see are the sutures. These lines have not yet fused together, and therefore these bones can actually move around. And we're left with these open spots known as fontanelles. These are the soft spots, and this is what's particularly different from the fetal skull compared to the adult skull. So we have 4 fontanelles on the fetal skull. We have the anterior fontanelle, the occipital fontanelle, the sphenoid fontanelle, and the mastoid fontanelle. The anterior fontanelle can be found at the location where the parietal bones meet the frontal bone. And it's called the anterior fontanelle because it's in front of the occipital fontanelle, which is found here towards the backside, next to the occipital bone and the 2 parietal bones. On either side of the skull, we'll have the sphenoid fontanelle, which is where the sphenoid bone will eventually end up, and then we have the mastoid fontanelle, which can be found behind the ear, where the mastoid process will end up being. So it is these 4 fontanelles that can be found on the fetal skull. But what we also must remember is that there is going to actually be 2 sphenoid fontanelles and 2 mastoid fontanelles, for a total number of 6 fontanelles. There's 4 different types, but specifically 6 fontanelles on the fetal skull. So the next component of the axial skeleton that we're going to discuss is the vertebral column. Vertebrae are the name for the bones that make up the vertebral column, which is very commonly known as the spine. Each vertebrae has individual parts, and together our vertebrae will stack on each other to form the vertebral column. The vertebral column is separated into 5 regions, and each region contains a fixed number of vertebrae. The first region is the cervical region, the second region is the thoracic region, our third region is the lumbar region, and then we'll have the sacral region and the coccygeal region. Each of these regions contain a fixed number of vertebrae. There are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, and 4 fused coccygeal vertebrae. Generally, when we discuss the vertebrae, we only include the cervical, thoracic, and lumbar regions, as the sacrum is 1 bone and the coccyx is 1 bone. Before the fetus is fully developed, we will have 5 sacral vertebrae, but they're eventually going to fuse, and that's what forms this heart-shaped bone known as the sacrum. And then we have the coccyx, which is going to be made up of 4 fused vertebrae. Those will eventually come together and again form a singular structure. So in the adult, truly, we'll have the 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Now, a nice easy way to remember this is breakfast, lunch, and dinner. You have breakfast at 7, lunch at 12, and dinner at 5. If you work the night shift, this trick might not work as well for you, but hopefully that's a beneficial trick to remember how many vertebrae can be found in each region. Now, each of these vertebrae are named based on their number. So for example, we have C1, C2, C3, C4, C5, C6, and C7. These stand for cervical 1, 2, 3, 4, 5, 6, and 7. And the thoracic vertebrae are named the exact same way. We have T1 through 12, and we have lumbar L1 through 5. The first and second cervical vertebrae are going to have their own individual names. However, the rest of the cervical, the rest of the thoracic, and the rest of the lumbar will all look the same, and we won't need to specifically learn the differences between the numbers. But you will have to understand how to identify a lumbar vertebrae, how to identify a thoracic vertebrae, and how to identify a cervical vertebrae, as well as understanding how to identify the first and the second. And we will touch on this very, very shortly. So each of our vertebrae in the vertebral column is separated by an intervertebral disc. The intervertebral discs are made up of fibrocartilage, and they will cushion each of our vertebrae and help them to articulate. The vertebral column will also have different curvatures. As you can see, the entire structure is not perfectly straight. We'll have the cervical curvature up, of course, in the cervical region, the thoracic curvature here in the thoracic region, the lumbar curvature down here, we have our sacral curvature here, and our coccygeal curvature as well. These curvatures develop over time in the infant, and we're going to see that the cervical curvature and the lumbar curvature are what are referred to as secondary curvatures because they're going to form after birth. The cervical curvature in particular will form so that the baby can raise its head, and the lumbar curvature will form so that the baby can walk upright. Naturally, infants have a C-shaped spine, and there's not normally the cervical and thoracic curvatures as we see them in the adult. But as the baby continues to grow, the cervical curvature will form, and that gives the baby the ability to lift its head, while the lumbar curvature will form and give the baby the ability to walk upright. So the cervical curvature and the lumbar curvature are known as secondary curvatures because they form later on. The thoracic curvature and the sacral curvature are always going to be present, so we call those primary curvatures. Each vertebrae is going to have one spinous process and 2 transverse processes that stick out of either side. The spinous process is named because it sticks out of the center of the posterior side of the vertebrae, and you can actually feel your spinous processes of different vertebrae coursing down the center of your back. The transverse processes, on the other hand, are named because they will course out to the sides, and we will see these structures labeled specifically very shortly. The other structure that we're going to grossly see on the vertebral column are the intervertebral foramen, which you can see are shown here. These are the foramen between 2 different vertebrae, hence why we call them the intervertebral foramen. So this picture will show us what a normal vertebral column will look like. Naturally, the vertebral column is going to be straight up and down, and it's not going to be curved towards either side. However, when we look at the lateral view, we'll see that we will have some curvatures that are supposed to be found on the vertebral column. There are, in fact, some pathologies that refer to abnormal curvatures of the spine, and we're going to look at those next. The 3 abnormal spinal curvatures are known as kyphosis, lordosis, and scoliosis. Kyphosis can be defined as an abnormal thoracic curvature, and you can see that this individual is bent forward as their thoracic curvature is accentuated. Now, lordosis is going to cause our patient to be bent backwards. Lordosis will refer to an exaggerated lumbar curvature. We can remember lordosis refers to our lumbar curvature because they both begin with an L. And lastly is scoliosis, which refers to any lateral curvature of the vertebral column. You'll remember that naturally the vertebral column was supposed to be straight down the center of the back, but scoliosis would cause the spine to be bowed towards either side. This causes the vertebral column to resemble an S shape, which is the first letter of scoliosis. So kyphosis is an abnormal thoracic curvature, lordosis is an abnormal lumbar curvature, and scoliosis is any lateral curvature of the spine at all along any location of the vertebral column. So let's take a look at the individual vertebrae and start to identify the different types of vertebrae that can be found in different regions. So there's 4 anatomical parts of every vertebrae that we need to be aware of, and 2 of them are ones that we've already spoken about. We have the spinous process and the 2 transverse processes. The spinous process sticks out the center of the backside of the vertebrae, and it can be felt along the spine. Hence why we give it its name as the spinous process. Now we have 2 transverse processes, a right and a left, that will course out towards the side. And we're going to see that the shape of the spinous process and the shape of the 2 transverse processes will help us to distinguish cervical vertebrae from thoracic vertebrae from lumbar vertebrae. We will also see that every vertebrae is going to have a vertebral foramen. As the vertebrae stack on each other, these vertebral foramen are going to form a long tube, and that is known as the vertebral canal, where the spinal cord will sit. And our last anatomical part of our vertebrae is the body, also known as the centrum. It is on the centrum that other vertebrae will stack. And on either side of the centrum of any vertebrae, there will be an intervertebral disc to protect our vertebrae from scraping past one another. So based on where they can be found in the vertebral column, our cervical, thoracic, and lumbar vertebrae will all look different. And just by looking at these vertebrae, we can learn how to tell the difference between these 3 types. So first and foremost, we see a superior view up here towards the top. The cervical vertebrae are naturally going to be the smallest vertebrae, as they have to support the least weight. Since just the head is sitting on the cervical vertebrae, they're not naturally supporting as much mass. But as we move down to the thoracic and eventually the lumbar vertebrae, these vertebrae are going to need to be adapted to support more weight. So one adaptation we'll see for this is the size of the vertebral body. The cervical vertebral body is actually going to be the smallest, the thoracic is going to be the middle-sized, and the lumbar vertebral body is going to be the largest. The cervical vertebrae will be unique from the thoracic and the lumbar because they will contain what are known as transverse foramen. These 2 holes here are the transverse foramen, and we do not see those on either the thoracic vertebrae or the lumbar vertebrae. The vertebral arteries are going to course through the transverse foramen. So by default, if you see a transverse foramen, you know automatically that we're looking at a cervical vertebrae. Now, aside from having a different shape and a smaller size, the cervical vertebrae will also have a much different spinous process than the thoracic and the lumbar vertebrae will also. The spinous process of our cervical vertebrae will bifurcate into 2 different points, while the thoracic and lumbar spinous processes will not. They'll be much longer and come to a single point, as opposed to having these 2 points over here as we see with the cervical vertebrae. We will also not see very pronounced transverse processes on cervical vertebrae, as those are often used to articulate with the ribs, and there are no ribs up in the neck. Now we've just compared this vertebrae to the thoracic and the lumbar vertebrae, and we can hopefully see how different the cervical vertebrae are from these other 2. But in fact, we can actually see a lot of differences between the thoracic vertebrae and the lumbar vertebrae as well. While in the superior view, the spinous processes do not actually look that different. If we move down to the lateral view, you'll see that the spinous process of the lumbar vertebrae and the spinous process of the thoracic vertebrae are arranged very, very differently. The thoracic spinous process is going to be angled downward and be very sharp. It's going to come to a point over here, and it will be pointed towards the floor. The spinous process of the lumbar vertebrae are not going to be pointed, they're actually going to be rather rigid and quite long, and they're going to be pointing outwards instead of downwards. So we can see a major difference between those 2 spinous processes here in the lateral view. Aside from the size of the centrum, which I've already mentioned, we also want to note the angle of the transverse processes. The spinous process and transverse processes of the lumbar vertebrae are going to form a 90-degree angle. These transverse processes will project directly out and in general be much flatter than the transverse processes of the thoracic vertebrae. And here you can see with the thoracic transverse processes, they will form an acute angle. So this arrangement is yet another factor that we can use to distinguish these 2 vertebrae from each other. One last difference that I will share with you is the shape of the vertebral foramen. The thoracic's vertebral foramen is going to be rather circular in its shape, while the lumbar vertebral foramen is going to be much, much flatter, and you can see that shown here. Now from the lateral views, we can also see some major differences here. Again, I have mentioned the orientation of these 2 spinous processes and their relative shapes. But one thing that you can also see here is the shape of the vertebral body. The lumbar's vertebral body is going to be the largest because it's supporting the most weight. The body of the thoracic vertebrae is still going to be quite big, but not as big as the lumbar vertebrae, and the body of the cervical vertebrae is going to be considered very small. So this slide helps us to compare and contrast these three different vertebrae from their superior views as well as their lateral views. But one other view that we can really use quite nicely to identify different vertebrae is the posterior view. And in fact, the posterior view is my favorite way to identify vertebrae from each other. Each of these vertebrae will resemble something that may look rather familiar. In general, the posterior view of our cervical vertebrae will look like a mouse. Now, lots of students have told me that this picture doesn't quite look like a mouse, but you can see these ears over here and the nose of the mouse right here. I have also received a lot of feedback that this picture in particular makes the cervical vertebrae look like an elephant. Whether it be a mouse or an elephant, or you prefer to identify the cervical vertebrae from the lateral view or perhaps the superior view, as long as you can identify it, that's what's most important. The thoracic vertebrae is also going to resemble something that we've likely seen before. The thoracic vertebrae in the posterior view looks somewhat like a giraffe. You have these two horns here, and the ears of the giraffe coming out on either side. And lastly, our lumbar vertebrae from the posterior view is going to look like a moose. So in all seriousness, when I have to identify these vertebrae, I attack these from the posterior view. But what is most important of all is that you can just simply identify these vertebrae from each other and that you understand their differences and why they are there. So what we need to understand about vertebrae is that they're going to be forming lots and lots of articulations with each other as they're stacking on each other and also articulating with the ribs. Each vertebrae is going to have a superior articular process and a superior articular facet that sits on the superior articular process. And we'll also have an inferior articular process and an inferior articular facet that are arranged just the same way. These superior and inferior articular processes and facets will be useful as our vertebrae will stack on top of each other. Now, the vertebral bodies aren't going to articulate with each other as there's going to be an intervertebral disc. But specifically, the superior articular facet that is on the superior articular process will articulate with the inferior articular process and facet of the vertebrae that is right above it. To demonstrate this, we can see two thoracic vertebrae together. On this superior vertebrae, we'll find the inferior articular process, and the inferior articular facet will be on the other side, which will contact the superior articular facet that's on the superior articular process of the more inferior vertebrae. And then we'll have that intervertebral disc that sits right between them. So our vertebrae use these structures to articulate with each other. But the ribs are also going to be coming in and articulating with our thoracic vertebrae in that region. And so our thoracic vertebrae will also have a superior costal facet and a transverse costal facet, which will be necessary to help our ribs articulate twice with each vertebrae. This picture will demonstrate the superior costal facet and how the rib's going to come in and articulate with that. And then over here we'll have that transverse process with the transverse costal facet, which will articulate with the second point on every rib. So every single rib will articulate with each vertebrae twice. You can see that this vertebrae is a thoracic vertebrae and this vertebrae is a lumbar vertebrae. So we won't have that costal facet on the lumbar vertebrae since no ribs are going to be articulating with these vertebrae specifically. As I know this might be a little challenging for us to visualize, I've posted this slide to help you get an idea of where the articular facets and processes, as well as the costal facets, can be found. I will not ask you any quiz questions about the information on this slide. This is just to support the information in the other slides. There's way more information on this slide that you need, but you can use these pictures for their visual purposes. So you can see the superior articular process up here, and you'll see the superior articular facet, which can be found just on that. We'll also see the transverse process and the transverse costal facet, which can be found here. And then we'll have our superior costal facet, and we also have an inferior costal facet, because each rib will articulate between two different vertebrae. Once again, you can see the generalized structure of our vertebrae. You can see the vertebral body, the vertebral foramen over here. You've got the spinous process and the two transverse processes, as well as the facets that can be found on them. Again, no quiz questions will come directly from this slide. This slide is just to support the other concepts that were discussed on previous slides. But I have posted this for you here so that you can get a better visual and so that you have more information on the topic. So we can see here how these vertebrae are going to stack on each other, but be separated by the intervertebral discs at the same time. The intervertebral discs will sit between the two bodies of two vertebrae, but will have those inferior articular processes and facets that are articulating with the superior articular processes and facets of the vertebrae that's just below. Now, with all of the other ligaments that are making up the vertebral column, we also will see the intervertebral foramen that are coming out either side. These are the foramen between two vertebrae, and you can see that right where these two vertebrae meet is where this foramen will be. The necessity of the intervertebral foramen will be to allow for our spinal nerves to travel out of the vertebral canal and course throughout our body. We will talk more about the spinal nerves when we get to the nervous system. So hopefully by now we're feeling fairly strong about distinguishing cervical, thoracic, and lumbar vertebrae. But I also mentioned that we do need to understand C1 and C2 separately. These two vertebrae will look different from the characteristic cervical vertebrae that we've now seen, and we need to be able to distinguish these bones as well. So C1 is known as the atlas. The atlas is the highest point of something, so it makes sense that we would call the highest vertebrae the atlas. The atlas will not have a vertebral body, but it will have superior articular facets that will articulate with the skull. Specifically, the occipital bone of the skull, with its occipital condyles, will sit nicely in the superior articular facets of C1. We're not going to have a very pronounced spinous process, and most of this vertebrae is going to make up the ring shape to allow for the spinal cord to project into the vertebral canal. But of course, every cervical vertebrae will have transverse foramen. So you will see these over here, which is a definite indicator that you're looking at a cervical vertebrae. So just to further elaborate, these superior articular facets are a bit larger than what we've seen on other vertebrae because these will articulate with the occipital condyles of the occipital bone. Now our last cervical vertebrae that we need to be able to identify is the axis, also known as C2. The axis is going to start looking more like a characteristic cervical vertebrae as its spinous process is going to start sticking out a little bit more. We'll still have those transverse foramen, so we'll be able to identify that without a doubt this is a cervical vertebrae. But what makes this vertebrae so different is that instead of a vertebral body, we have the dens, also known as the odontoid process that sticks out of the superior aspect of this bone. The atlas will sit on top of the axis, and the dens will project out through the vertebral foramen of the atlas. So our final components of the vertebral column are the sacrum and the coccyx. The sacrum is a heart-shaped bone that's formed by 5 fused sacral vertebrae. You can roughly see their shapes separated by these lines here. The sacrum is the base for which all of the other vertebrae will sit upon. And attached at the very bottom we'll find the coccyx, which is made up of 4 coccygeal vertebrae that are also fused. The common name for the coccyx is also known as the tailbone, and those of you that have hit your tailbone before know how painful this can be. The final component of the axial skeleton that we're going to discuss is the thoracic cage. The thoracic cage is composed of 12 ribs on either side. And just as we saw that we have different amounts of vertebrae, we'll also have different types of ribs and fixed amounts of those as well. We'll find true ribs, false ribs, and floating ribs, all making up the thoracic cage. What makes something a true rib is having its own individual costal cartilage that will attach to the sternum. Some of our ribs will have their own costal cartilage, and some of them will not. And if they do have their own costal cartilage, they're classified as true ribs. False ribs, on the other hand, do not have their own costal cartilage to attach to the sternum by. These will attach to the sternum indirectly through the costal cartilage of true rib number 7. And we'll also have floating ribs which do not attach to any costal cartilage at all, and therefore do not attach to the sternum at all. In particular, we'll find 7 true ribs, 3 false ribs, and 2 floating ribs on each side of the thoracic cage. So we want to remember that ribs are in fact flat bones, and one side is going to articulate twice with every vertebrae, as we saw a couple slides ago. But as we start to get towards the anterior side of the thoracic cage, we'll start to see some other cartilage that can be found in here. This is hyaline cartilage specifically. These first 7 ribs are the true ribs. True ribs, by definition, attach to the sternum through their own costal cartilage, and we'll see that shown here. False ribs are slightly different in that they will not have their own costal cartilage. They will attach to costal cartilage, but their costal cartilage will attach to the 7th costal cartilage over here. So these 3 will be the false ribs. And then we have 2 floating ribs that do not attach to the sternum at all. The whole purpose of the thoracic cage is to protect the heart and the lungs inside of the thoracic cavity. We will also see that the structures that make up the sternum will too contribute to the thoracic cage. But in total, we'll have 24 ribs, 12 on each side, that all serve a protective function to our organs in the thoracic cavity. You can see a section of a rib here that really shows you how this is a flat bone. Even though the ribs are longer than they are wide, they don't have an epiphysis and they don't have a diaphysis. Each rib is going to have a vertebral end, and each rib will have a sternal end. The sternal end tends to be a bit sharper as it's going to articulate with the costal cartilage, which will eventually make its way over to the sternum. And the vertebral end, we know, articulates with the vertebral column twice. So there's going to be a second projection here where the vertebral end articulates with the transverse costal facet on the transverse process of our vertebrae. The sternal end in particular is articulating with our costal cartilage, which comes in and meets with the sternum. Now the sternum can be separated into 3 different parts. We have the upper manubrium, we have the middle sternal body, also known as the gladiolus, and then we have the lower xiphoid process. You can remember the manubrium because it's roughly shaped like the letter M. However, an even better way to remember the arrangement of these 3 components is alphabetical order. The manubrium can be found up here that starts with an M, the sternum can be found here in the center that starts with an S, and then the xiphoid process, which starts with an X, will be found at the base. The manubrium will be one of the locations where our appendicular skeleton meets the axial skeleton, since the clavicles will come and articulate with this bone. On either side of the manubrium, we'll see the clavicular notches, and in the center, we'll find the jugular notch. Each of these components of the sternum can be found in reference to other structures in the body. For example, this structure right here is the largest artery in the body, known as the aorta. We can always find the arch of the aorta right behind the manubrium. And we'll also see that directly behind the sternum, we'll find the heart. The location where the manubrium meets the body of the sternum is known as the sternal angle. And the sternal angle sits right at the space between T4 and T5. We'll also see here that the xiphoid process begins at the level of T9. So that will conclude our presentation on the axial skeleton. If you have any questions at all about this material, please reach out to me so that I can hopefully help you understand how our axial skeleton is arranged. In the lab, we'll have an opportunity to view some models and actually view some real bones as well. The Pensacola State Library offers free bone boxes that you guys can go and use to also get some more exposure to these bones. Bone and bone marking identification are going to be a heavily weighted topic when we get to the midterm exam. So make sure that you're feeling comfortable about the different bones that can be found in the axial skeleton and the different bone markings and regions that are associated with each. I will see you all in our next lab recording when we will cover the appendicular skeleton.